They were in a program, costs were going up, really frustrated with it. They'd acquired a couple companies at the time. They had 4 or 5 programs running, getting 20, 30% increases on every group. And really, we did a lot of education and coaching with them, but they still, 2 years in, are just now figuring out how it works. And I think it's the perfect example of they're trying to run a manufacturing business, multi-state, multi-location. They've got a full plate of things going on in their day-to-day. They don't have someone in-house that's committed to healthcare at this point. But even for them, being a group with, 150 employees or so, they've just now, the light bulb's gone off for them, how important it is to constantly manage the healthcare program. When we started, with their ecosystem and the, partners we put in place, it's ran really well. Yes, they've saved money first 2 years, but now they're starting to see, okay, if we want this to continue to work, we have to continue to either focus on claims, manage claims, or be proactive in where we're headed. So that's a conversation we had with them literally last night. We were there till late, and it was kind of in the war room, going through their data, going through what's happening, what's driving cost, how are the things that we've implemented, how are they working? And it was neat to see like their eyes kind of light up and go, hey, like that was really hard for the first 90 days, but we're seeing the fruit of it. Now 3/4 of the way through the plan year when they've made some of those transitions. So the really neat piece, though, is seeing the founder and the president now, light bulb go off in his head. And even though he, on the front end, was involved with the conversations, he is now all in. And the light bulb's gone off. He's seeing the data. He's realizing how different it is than where they were. And really how different it is now to what his, I think, assumption was of what healthcare is. And
what was his assumption?
I think the assumption is, hey, it's a black box. We go get a quote, and that's all we can do. And even that assumption has somewhat floated over into their current program because there is still frustration. Costs are still high. High compared to what, though, is what the conversation we were having last night. And when we look at it, on a national basis from a per employee per month cost, being able to know where you're at, what's driving those costs, how do we attack those costs, what are the things we can do? I think seeing that come together and click in his mind with his team all in the room, so an HR professional, a founder, a CEO, and a CFO, seeing them all on the same page kind of have these realizations of healthcare is frustrating. In the position we're in today, employers that want to attract and retain talent and hire good people, like they have to have a good program. And that's something we're trying to solve at one of their locations is they're frustrated with the cost of dependent tiers. What do we do? How do we do it? And there's nothing out there that's a fastball. We talked about different products. We talked about things like reference-based pricing and ICRAs. And we could talk through the pros and the cons of some of those. But at the end of the day, those are just products. They're not necessarily solving the actual problem. And the problem is what they're realizing now is seeing like what's driving our costs. What are we spending our money on? How's it being spent? And it was really interesting to see specifically with their leadership team who has had some of their own claims, see their claims, point out like, hey, that was probably me. And understand that their decisions impact the entire plan. And I think that at the core of it is where we're seeing the highest performing clients really start to, really impact their entire population and their entire plan is when that light bulb goes off and, hey, when I go get the right knee surgery, I have options. I have options where to get it. And I don't have to just be a product of the system. But today, the world we live in, it's really hard to get people to make those better decisions.
And it sounds like that's where they were. You mentioned 2.5, 3 years ago, they were getting the 20, 30% cost increases. So I'd be curious, what were they feeling then when you all got introduced? What were the conversations like then? It sounds like now the conversations, there's light bulbs going off. You're creating clarity. You're really solving for confusion for this client, for this group of leaders, and you're getting the CEO, the CFO, and the HR director all on the same page to solve healthcare for their company and for their employees. But I'd love to understand, what were they feeling 2.5 years ago when you first sat down with them? What were the conversations like then? Were they aligned? Were they misaligned? What did that look like?
Yeah, and it's a great question. It's something that even has popped up, is that in the initial conversations with them, they didn't know where they wanted to go. They were running 5 or 6 different plans at the time. They're a holding company. So they had all these different pieces running. They weren't doing anything really to leverage where they didn't have a plan. They didn't have a vision. They didn't understand, what their options were. So what we did with them is walked part of their team through a process at that time early on, a couple years back, and laid out a vision. But the disconnect was everyone wasn't involved with that initial vision. So that's why now we're going back and having some of the conversations. Here's why we did what we did. And people have left the company. People have joined the company. So it's a constant maintenance of that vision and where are we going? How are we getting there? And that's, I think, part of what they're realizing. It takes effort. It takes effort from the leadership team. And for them, the real struggle, they're at the holding company level. They've got to get the leaders at each location and entity bought into that. And that's what we were working on last night, is how are we going to get people to do this? So it's a work in progress, but I think going back to where they were is getting surprised at really the mercy of carriers coming and saying, hey, here's a 20 or 30% increase. You've got 60 days to figure it out. And understanding, what are we going to do with this? What's it mean to our employees? How are we going to really stomach the cost and the trend renewal plus our claims increase? So then we started talking about these different options, right? And hey, here's where we could go. Here's where we could be in the next 2 to 3 years. And what we've seen now is we now have the data. We know what's driving their cost. We know in their population what needs to happen for long-term success. They're in a manufacturing business, blue collar, high retention, low turnover in their business. They've got a great culture. What comes with that is, their investment in the long-term health of their employees. And they're doing some of those things now, but even more to see it click last night and say, hey, we've really got to get people engaged. We've got to get them to be able to drive decisions to providers, to higher value providers, and be able to have employees understand the plan better, how to maximize the plan, how to utilize the plan better. So it's been interesting, going back to your question, I'd say a lot of confusion, unclarity, not knowing why they're getting those cost increases, to year one success for sure. Being able to see, okay, here's what's happening. And, it's the first year they didn't have to have plan changes and they didn't have to have cost increases or do anything with, deductibles or changing employee contributions. So for them, that was a win, year one. Now we're in year 2 and they're really looking at, okay, now we really see the full picture. We understand how the plan works. The light bulb is going off that they can have an impact throughout the year, not just at renewal. And now we're looking at those different solutions to solve for their specific data. We're not just coming with a product saying, hey, we can reduce your cost by 10, 15%, or hey, there's guaranteed ROI here, this or that. But really looking at their data to build revisit that 2 to 3 year strategy, look at the data, implement and roll it out and educate their frontline employees, but also the mid-level managers. And then I think the last thing there is why. The thing I heard last night from their HR leader and operations leader was, we did all this, but I don't think we ever did a good job communicating to our mid-level managers and our entity managers why we did it. And they're starting to see some of the frustrations with that now. We're having to go back and repair, I would say, some of the lack of education throughout the organization now. Because people are saying, hey, what if we had just stayed with X? What if we just stayed with the big box carrier? What would our costs look like? And everyone hears in the marketplace right now, costs have gone up 10, 20, 30. We've got some clients that have had 40% cost increases in some of the big box programs. And that group, though, knows for a fact they're all in a better spot doing what they did and making the decision they made. So I think that confusion, it's still lingering. And now we've got to go back and solve for some of that throughout the organization and make sure everyone understands why we've made and why we're building the program we're building. Because it's not just health insurance, it's a healthcare program.
And it sounds like a lot of your strategy there was, yes, focused on healthcare strategy, but a significant portion was on education.
Yeah.
And getting employees to understand the why these changes are happening and how does it impact them, their independent wealth, and what comes out of their paycheck every single pay period, and then how they can have an actual impact on that. I think it's really interesting, and it blows my mind that anywhere in the US, someone can just come to you, and this is a carrier in healthcare, and say, hey, you all get a 30% increase. You have 60 days to figure out what to do. Best of luck.
Yeah.
They kind of wipe their hands clean and say, good luck, figure it out. And they give you no data. And then for an employer, it's a scramble to figure out, what do I do? How do I fix this? Likely you're calling to other brokers, and other brokers are just pitching you a product saying they're going to solve this for you. You're going to save 30%. It's going to be great. And then next renewal comes and you get another 30% cost increase. Mm-hmm. And it's just this vicious cycle year after year after year. And it makes no sense why it's happening. And it sounds like what this employer, your client, is feeling is they went from that realm of 60 days every year, a mad scramble to figure out healthcare, to year-long managing the program, which it is a night and day difference. But now they're actually seeing where the data is coming from, why they may be getting the renewal they're getting, where their claim spend is going, and what they can do to impact it.
Yeah.
And what the real focus is now on is getting the employee population engaged on the why they're in this program. Because at the end of the day, yes, you can have a great strategy, you can have a great product, you can be in the best captive in the country, and we have clients in those, or you can be in the worst captive in the country. Depending on whatever you want to be in, you will never solve healthcare unless you can get your employee population engaged with your program, because they are driving your spend. Yeah. If you have all these tools and trinkets, but employees don't know what they are and don't know how to use them, you will never have success. So it's really a 3-tiered approach is what we've taken. It's build the right strategy with the right partners in the program, design the plan to incentivize the right utilization, and then educate your employees on how to actually use the plan that you're offering them. That process and what that is right there, it's not a 2-month fix, it's not a year-long fix, it's a 4, 5, 6, 7, 8-year fix. It's a strategy, it's a program. You're not buying health insurance, you're creating a long-term healthcare program by doing this.